as a cancer immunologist and also lymphoma specialist, I was interested in the approach that folks in the solid tumor world have taken to categorizing tumors, such as melanomas, for example, into those that have somehow activated an immune response by the host or by the patient versus those that haven't. And the reason that that's important is because we know from immune checkpoint blockade trials that patients with solid tumors who have lots of immune cells within their tumor are much more likely to benefit from treatments like anti-PD-1 therapy or CTLA-4 blockade therapy. And so, as a lymphoma doc, I became interested in trying to put together in this review article what we know about the immune landscapes that are associated with different types of lymphoma, particularly the common B-cell lymphomas like diffuse large B-cell lymphoma and classical Hodgkin lymphoma. We already know from clinical trials and from some preclinical work that there are certain lymphomas, such as classical Hodgkin lymphoma or a rare type of non-Hodgkin lymphoma called primary mediastinal B-cell lymphoma, that these lymphomas are quite responsive to PD-1 blockade therapy, whereas diffuse large B-cell lymphoma, which is the most common form of non-Hodgkin lymphoma, in general is less responsive. And so putting that sort of together in this review, we kind of came up with a characterization schema of lymphomas into those which were quote unquote immune inflamed versus those that were not. And our hope is that, for example, in immune inflamed lymphomas like Hodgkin lymphoma, like primary mediastinal B-cell lymphoma, and like subsets of diffuse large B-cell lymphoma, we hope that we can use this sort of approach to classify lymphomas into those that are likely to benefit from immune-based therapies, and as well as those that aren't. So we can hopefully predict which patients will benefit and which patients to move on and pick some other type of therapy.